Welcome to Ararat Healthcare and Charkos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charkoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay your achieving your dreams any longer and sign up now. Let's talk about assessment. So this new assessment, you get 20 minutes and that includes your reading time. You'll have one page, just an A4 side of background on your patient and the scenario. So take your time to read that, but allow yourself at least 15 minutes to do the actual assessment, complete the observations and document all of the vital signs according to the NEWS or GCS chart, whichever scenario you get. Okay, this assessment is now an A to E assessment, so make sure it's really clear that you are working in that process, doing airway, breathing, circulation, any disability and exposure. Please note you will not be expected to actually expose the actor, undress the actor for that part, so ask any questions that are relevant for that part of the examination. Okay, entering the room, checking for the scene safety. It's safe to approach the patient and providing privacy and dignity by making sure the curtains are closed. I'm going to do my hand hygiene using alcohol hand rub, palm to palm, palm to dorsum, fingers interlaced, fingers interlocked, rotation of the thumb, tips of the fingers, and finally the wrist. Good morning.
Good morning.
My name's Julie, I'm one of the nurses looking after you today, and I've come here now to do a nursing assessment on you, which includes your observations like your blood pressure and pulse, etc.
Okay.
Would now be a convenient time to do that?
Okay.
Wonderful. So can I just confirm your full name and date of birth, please?
Yeah, my name is Ash Potter and date of birth is 1st of January 1950.
Super. Can I just confirm that with your wristband as well, please?
Okay.
Okay, so Ash Potter, 1st of the 1st, 1950, hospital number 0004321, 0004321, super. I can see you have a white wristband on, Ash. Is it okay to call you Ash?
Yes, it is fine.
Okay, lovely. So, do you have any allergies that you're aware of at all?
No, I'm not allergic to anything.
Super, so you have got the correct wristband on there. So I'm going to do what they call an A to E assessment. So I'm going to start with your airway, and I can see you're clearly talking to me, and it's clear to me that there's no blockage or anything there, you're not experiencing any difficulty. So next I'm going to move on to your breathing, and I can see also looking from a distance that you seem to be breathing with ease. There's no seesaw movement or use of your accessory muscles, and I can't hear any audible wheeze or stridor. Have you been experiencing a cough at all?
No, I'm
Super,
fine.
super. And you don't have any difficulty in your breathing at all?
No, I'm feeling alright.
Lovely. Okay, so now we're moving on to C, which is for circulation. So I can see that you always don't look overly pale or anything, but I am going to check your capillary refill. Is that okay?
Yeah.
And I'm going to squeeze and release your finger, and that's great. Okay, Ash, I'm going to check your blood pressure and pulse. Is that okay?
Okay.
I can confirm that this equipment has been cleaned and calibrated. and therefore is safe to use. Do you have any preference on which arm I take your blood pressure on?
No.
So I'm on your left side, so I'm going to take it on the side if that's okay. Do you mind if I pull your sleeve up?
No, it's okay.
Okay, that goes up. Have you had any surgery to this arm?
No.
Okay. And what about to your chest? Any lymphedema problems or anything like that I need to be aware of?
No, I'm fine.
Super. Okay, so have you seen one of these electric blood pressure machines before?
I have.
Okay, so you know that they're gonna get a little bit tight, but that will resolve as soon as the blood pressure has been recorded. So I'm making sure that that goes around 80% of your upper arm, and that I have positioned the wire in line with your artery, and that there's 2 to 3 centimeters space above the anticuticle fossa. Okay, I'm checking that you're lying still. Please don't cross your legs, and just be relaxed whilst that works. Is that okay?
Yeah, that should be fine.
Okay, so as I said, it's going to get tight. I'm just starting that now.
Okay.
Whilst that's doing, I'm going to do your pulse oximetry. So I'm going to place this on your other hand. And again, checking that it's not cold or clammy, and that you haven't got any false nails or nail varnish on there, Ash. And I'm going to stick this on your finger and turn it on. Okay, I'm going to leave that there for a minute. Okay.
Okay.
Hope that wasn't too bad. Blood pressure's done, Ash.
Okay.
We'll take this away. And I'm going to pull your sleeve back down. Is that comfortable?
Yes, it is.
Wonderful. Okay. So I'm going to take that one away. The next thing I need to do, Ash, is to take your pulse.
Okay.
So you might, I'm going to take your radial pulse. So I'm going to find your pulse here. Is that okay? I'm going to be counting for 2 full minutes, Ash. Okay. Do you mind if I just place your arm across your chest there?
Yeah, that should be fine.
Okay, so I'm not going to be able to talk because I'm going to count. I'm not that clever. But if you need anything or you're in pain or anything, please just stop me and we can start again.
Okay.
Okay. So your 2 minutes start now. Wonderful, thank you, Ash. That's the 2 minutes completed. Actually, I counted your pulse for 1 full minute, but I also counted your respiration for 1 full minute as well. I didn't tell you beforehand because when you know that someone's counting your breathing, it changes the way you breathe. So I'm sorry about that.
It's okay.
Okay, so I am just going to document these results before I move on. So bear with me for a minute, Ash. Okay, so we have here a news chart, and your name, date of birth and date of admission is here, and I'm going to put today's date, and it is 10 o'clock. So your respirations were 20. Your oxygen saturations were 95. You are on air. Your blood pressure was 108 over 66, and your pulse was 88. Okay, and you are 1 second. So, Ash, I would like to ask you a few questions just to help with the D for disability. Are you on any prescribed medications at all?
Yes, there are medications which I take. I suffer with hypertension and glaucoma.
Okay.
So,
have you taken what you're due to have had to so far today?
Yes, I have taken my blood pressure medicine and my eye drops.
Perfect, okay. Blood pressure and glaucoma. Please, Ash, can you tell me, do you have any other problems with your heart or epilepsy or diabetes, anything like that that we need to know?
No, I'm okay otherwise.
You're otherwise fit and well, okay.
Yeah.
Can I ask, how have you been eating and drinking since you've been home?
So as you know that I had this operation. So since the operation I am not eating very well because I'm suffering with constipation as well.
Okay,
Although
so how long
yeah.
since you've had your bowels open?
It's been almost 4 days.
Okay. Are you drinking okay?
Yeah, but do you mean water or?
Okay, so do you have any alcohol consumption?
Although I don't want to admit it, but I have been drinking a bit more than what I would like in the last few days.
So on an average day, how much would you say you've been drinking?
Sometime 2-3 pints.
Okay, and is it lager or beer, or what is it your preference to drink?
Whatever I can find.
Okay. And that's suddenly increased since you've been at home?
Yeah, normally I would only drink a couple of times a week, but now it is happening almost daily.
Okay. Well, so 4 days since your bowels. And it's been 10 days that you've been at home since your operation, is that right?
Yes.
So the last thing I need to do there is I need to confirm that you are alert, you're not confused, you're not unresponsive or slow to respond in any way. I would like to take your temperature as your final observation. So have you seen one of these machines before? This
I
is
have.
on your ear.
Yeah.
Okay. So can I ask, do you have any hearing aids at all?
No, I don't wear any hearing aids.
Okay, and have you had any ear infections or any problems with your ears at all?
No.
Are you happy for me to do your left ear?
Yeah, that's fine.
Okay, so I'm just taking a look. I've put a clean cap on and I'm going to put this in your ear and it's going to beep. Okay, super, wonderful. And I'm going to dispose of that in the critical waste. And getting my hand ready. Okay, your temperature is a little bit raised at the moment, which is to be expected with what's going on with your wound. And whilst I'm talking about your wound, I would like to have a look at your wound, if that's at all possible.
Yeah, although it has recently been dressed, but you can have a look.
Okay, well, tell me about your wound then, Ash. Is there any oozing that's been coming through? Any pus?
Yes, the nurse was saying that there was a little bit of 1 or 2 stitch had come off and a bit opening, and there was a little bit of a discharge.
Okay.
So she's taken a swab, I think, from there.
Wonderful. And what about the rest of your body? Have you noticed any rash or anything anywhere else?
No, otherwise I'm okay. There is no other rash anywhere.
Okay. And around the actual wound, when you said there's a little gaping, did the nurse comment whether it looked any swollen or inflamed at all?
Oh yes, she mentioned inflamed.
Okay. Super. Okay. Right, I don't know whether you remember when you was in hospital last time, but we have this form which is called the news form, the National Early Warning Score, which we would log your observations on, and that gives us an indication of how regularly we need to be assessing your observations. So let me just spend a second to calculate. So we have 1 for your oxygen levels, we have 1 for your blood pressure, and 1 for your temperature. So we have a total score of 3, which means that I'm going to come back and monitor your blood pressure and all your pulse every 4 hours at the moment. Okay, I am going to escalate it to the doctor just to make sure that they are aware of your temperature that you've got going on there. Okay, and I'm going to sign that. That's your observations complete, but I would just like to ask you a few more questions to help us look after you whilst you're here. Is that okay?
Yeah, that should be fine.
So tell me, Ash, what in the last 10 days, I know you've been at home, I've read from your notes that you've been at home on your own, and your partner's been staying with your daughter, is that correct?
It is.
Okay, so how have you been coping on your own?
Well, it's a bit difficult to be on my own. Thankfully, my daughter and sometimes my son-in-law, they come in and bring me the food.
Okay.
Yeah, but mostly it's the loneliness.
And how have you been coping with that then? Have you been having a low mood?
Yeah, it does make me feel a bit low, and I find it difficult to find interest in doing anything.
So do you find that you've lost concentration, perhaps if you're trying to read or watch a TV program or something, are you able to concentrate on it?
Yeah, I do try, but sometimes it is difficult, especially when I start thinking about what has been going on. Yeah, although I try my best to keep myself engaged.
You've got a lot going on at the moment, Ash. You've had a big operation and you've got a lot with the diagnosis and everything that you've been given. So you really do need to have access to someone that you can talk to and to share this so that you can help get through this. Would you class yourself as a religious man at all?
I don't particularly, but I am not religious, so yeah.
Okay, I just wanted to let you know that if you wanted to talk to someone other than us and stuff, which we're here to support you all the way, and sometimes it doesn't feel comfortable to talk to us or even your partner or your daughter, etc. If you want someone outside of this circle to talk to, we do have a multidisciplinary, multiple faith chaplaincy available here that will just come and talk to you so you can discuss, rant, do whatever you want if you open. So I just wanted to let you know that there was someone here if you wanted to do that.
Okay. Thank you.
So can I just ask some more specific questions about your physical capabilities?
Okay.
So since you've been home in the last 10 days, have you noticed any difference in your ability to complete your personal hygiene?
Yes, it has been more difficult, more because of the pain and because of the operation wound and all that thing. So I do find it a bit challenging, but I am managing.
Okay. So you mentioned pain there. Can I ask you to rate your pain? If you was to say that no pain would be 0 and 10 would be the worst pain imaginable, where would you rate your pain right now?
Maybe around 7 sometimes, but sometimes less. After medication it comes down to 4 or 5.
And so what's the best it can get once the medication's kicked in?
Oh, majority of the time it is around 3.
Okay. Have you had any analgesia recently, do you know?
Not since morning. I have not taken anything.
Okay. I will double check your chart and see if there's anything I can give you. I think if we can try and keep your pain at a reasonable level, it will mean that you are able to do a little bit more for yourself, and that will help with your frustrations and your mood as well a little bit. If you feel that you're capable of being able to have a little bit of the life that you had before your operation, okay?
Okay.
Okay, so Ash, what about walking?
I'm able to walk, but again, after the operation, it has become more difficult because it has definitely decreased my mobility.
Okay, okay, that's all I want to pester you with right now. I'm going to go and write up all of this information you've told me, and I will double check about the painkillers if you need it, if there is anything there available, and I'll speak to the doctor if there isn't any that you can have right now, because we really want to get that under control, okay? So before I leave, I'm going to leave you with the call bell, so please, because you're having a little bit of difficulty because of the pain and with the mobilising and everything, if you need anything at all, please use the call bell and one of us will come and assist you, okay?
Okay.
Are you comfortable before I leave?
Yeah, at the moment I'm
Is there
fine.
anything I can do to help you before I go?
No, it's all right.
Okay, right, nice to meet you, Ash, and I will be back very shortly once I've spoken to the doctor.
Okay. Okay.
Open the curtain so you can see. Bye for now.
Bye.